Lagos State Blood Transfusion Committee, LSBTC, have held a one-day structural training for nurses in the state, tagged Train the Trainers. The seminar is part of the Lagos state government and the LSBTC's commitment to promote safety practices during the blood transfusion process. Over 110 nurses from both the public and private sector were present at the training to ensure a holistic approach in healthcare provision. Speaking in an interview with WeZoom News, the executive secretary of LSBTS, Dr. Bodenrin Oshikomaya, harped on the essence of the seminar. She expressed hopes that the trained health providers will in turn train others at their various hospitals of service.
The nurses are deemed to be the most critical part of the blood transfusion because they are always there. They are the ones that are closest to the patients. They are the ones that will say if there is a reaction or not. They will say if the blood transfusion has gone smoothly or not. They are also there to ensure that the blood is actually of the good quality that we expect that it should be transfused. Another thing that will happen during this training is that the nurses here will be inaugurated as safe blood transfusion champions, and that means that they will take the teaching here to their respective facilities to ensure that each facility has and is strengthened a blood transfusion committee, and they will ensure that any vigilance reactions will be reported back to the blood transfusion service. So all in all, we have made them the key sets of people to ensure that the safe blood transfusion practices we have been teaching all healthcare personnel is implemented and well established. So we have over 110 nurses invited here from both the private and public sector, from the federal and the state sector. So we have from the military hospitals too, from the police hospitals, naval referral centers who have been invited. We have people from the secondary healthcare facilities, that's the general hospitals, and the tertiary too. We have from LASO, that's Lagos State University Teaching Hospital, as well as Lagos University Teaching Hospitals. We have from the federal medical centers at Ekpe and at Ebutimeta. So it covers every facility here. We have over 30 private hospitals invited here, and the nurses that were nominated from these private hospitals range from 1 to 5, depending on how big those private hospitals are. So it's really not just training for the public sector, as people usually believe in, but for all nurses in Lagos State. So all that's been taught here will not end yet and should not end here. We expect them to take it out to their respective facilities to teach all other nurses. That is why you will see that the banner says the train the trainer session. It's not going to end here. We're going to have another one before the end of this year. We are going to interact with these nurses. We will check them up in their respective facilities to ensure that all what we've taught them here is also being done by other nurses. So we are telling all the nurses here that it doesn't end here. It is a call for more action and more work to ensure that safe blood is a norm in Lagos State. I'm Dr. Bodenrin Oshikomaya, the Executive Secretary of the Lagos State Blood Transfusion Service.
Other stakeholders like Dr. Oluwatomi Adeyemi, the SSA to the Lagos State Governor on Health, reeled out the benefits of the training to both the nurses present, their places of work, the patients under their care, and the Lagos State government as a whole. A consultant hematologist with the Lagos State Teaching Hospital, LSUTH, Professor Ebele Uche, expressed hopes that after this training, the nurses would be able to recognize blood transfusion reactions, which would prevent a possible complication in the process.
Good morning, I'm Dr. Oluwatomi Adeyemi, Senior Special Assistant to the Lagos State Governor on Health. So I think this training is actually very important. It's been put together by the Lagos State Blood Transfusion Committee, and then they are training them on how to ensure safe blood transfusion practices. So apart from the Blood Transfusion Committee ensuring that we have blood available, the way in which this blood is administered eventually to the patient to ensure safe practices is actually very important at all our levels of care, secondary and tertiary level of care in particular. And at this training, we have people both from private and from the public sector. We have from the military hospitals. We have from different hospitals represented around Lagos. So my message to them, even as they are being, Lagos State is interested and committed to professional development of all our healthcare workers across cadres. And even as they are partaking in this training, I don't want it to stop here. So even when they go back, because it's the trainers training, so they are meant to go back and impact this knowledge and train other members of staff at their various hospitals to ensure that eventually any blood that is transfused in Lagos State is one that is of good quality and one that is transmitted without any adverse effects as much as possible. So Oluwatomi Adeyemi, Senior Special Assistant to the Lagos State Governor on Health.
The theme of the seminar is Ensuring Safe Blood Transfusion Practices. Also at the seminar, Lagos residents were charged to donate blood whenever they can and see it as a life-saving act of kindness.
My name is Professor Ebele Uche. I am a consultant hematologist with the Lagos State University Teaching Hospital. Okay, so the major aim of this training is for the nurses to be able to identify transfusion reactions in their patients, because they are the ones that would usually stay with the patient throughout the transfusion process. The doctor just orders for a transfusion and goes away, but the nurse is the one that is actually on the ward with the patient. And so it's important for the nurses to not just have a mental knowledge of what the transfusion reactions could be, but they should be able to recognize such transfusion reactions, because we know that even though blood transfusion can be a life-saving intervention, it is also fraught with a lot of complications, and a lot of these complications could also lead to death in the patient. And so we want to make our transfusion practice in Lagos State to be as safe as possible, meaning that a patient should never die of a blood transfusion. And so the importance of this training is to be able to train the nurses to recognize transfusion reactions, to train them to know what to do in the case of a transfusion reaction. So when they go back to their various health facilities, they now also would serve as trainers to their colleagues. And so in this way, we can ensure that transfusion practices in Lagos State are safe for the patient. There's a lot of advocacy that goes on, but we also know that there are some religious sects that whatever you say to them, they just will not accept blood, right? But it still doesn't mean that as a health practitioner, we don't try. So a patient says to you, oh, my religious belief says I shouldn't take blood. You don't just take it hook, line, and sinker and go. You should, as a health practitioner, make an effort to educate the patient properly. And I can assure you that a few patients have changed their minds, because especially when you know that the transfusion is what is going to save this patient and there's no other option available. So the important thing is always make sure that you communicate properly to the patient, so that when the patient is refusing a transfusion, it is an informed decision. The patient understands why he or she needs a transfusion, understands the importance, understands the risks that are associated with not getting a transfusion. And then it's continued advocacy, continued advocacy. All of us are advocates. So we are all ambassadors of transfusion. So we go back into society and we're able to tell people that, look, transfusion, especially in Nigeria, there are so many cultural connotations to transfusion, but we should be able to tell the people out there that there's nothing wrong in getting a transfusion if that transfusion is going to help save your life. Professor Ebele Uche.